Corpulmonale, when lung disease breaks the heart. Kevin Waitito asks, Doc, kindly discuss corpulmonale and use of sildenafil in heart failure. And many others like George Kuria, Josto Plato, Akiki have asked about corpulmonale. Today I want to talk about corpulmonale, a condition where the heart struggles because of lung disease. So what is corpulmonale? Corpulmonale happens when the right side of the heart fails due to long-term lung problems. Right-sided heart failure due to problems in the lung, or high pressure in the lungs, what we call pulmonary hypertension. Unlike other heart failures, the heart is initially normal. The problem starts in the lung, and over time, the right heart has to work harder and may eventually fail. So this is how it happens. Chronic lung disease or low oxygen levels in the blood makes the pulmonary blood vessels to tighten. The pressure in the lung rises, pulmonary hypertension. The right ventricle works harder. The right ventricle pumps blood from the heart to the lungs for oxygenation. So it has to pump against resistance. It works harder. With time, it enlarges, strains, and eventually fail. So corpulmonale is right-sided heart failure secondary to a lung problem. The left side of the heart is normal. This is why treating lung problems early is important to protect the heart. What are the causes of corpulmonale? The most common cause is COPD, chronic obstructive pulmonary diseases, those with chronic cause. Severe asthma can also cause pulmonary fibrosis, post-TB lung damage, TB lung fibrosis, and chronic blood clots in the lung can also cause chronic thromboembolic pulmonary hypertension. Sleep apnea or obesity-related breathing problems is another common cause of corpulmonale. What symptoms do you watch for? There is shortness of breath that worsens over time. There is fatigue and reduced ability to tolerate exercise. You also get swelling. There is swelling of the legs, the ankles, and also swelling in the abdomen. There is neck vein distension, what we call JVP, and later you get palpitations or dizziness. In severe disease, the lips turn blue and even the fingers because of low oxygen. So if you have a lung problem and develop any of those, breathlessness, leg swelling, abdominal swelling, you need to see a cardiologist. The lung is the primary problem. The heart is a secondary victim. How do we diagnose? Doctors use a combination of things to make a diagnosis. Very important physical exam to look for right-sided heart failure. There is swelling of the leg, abdomen, ascites in the abdomen. There is liver enlargement. There is also JVP elevation. For the test that we do, you do an ECG that can show strain and an echocardiogram. We have lung function test, and cardiac catheterization is a gold standard to assess pulmonary hypertension. So treatment of corpulmonale, the key principles. Number 1, oxygen therapy, very important. Number 2, treat the lung disease. For heart failure, use your diuretics. Then you treat pulmonary hypertension with a specific medication and anticoagulation if indicated. So treat the underlying lung disease. Is it COPD? Use your bronchodilators or inhaled steroids if indicated. Pulmonary rehabilitation, you treat with a pulmonologist. If it's sleep apnea, CPAP. Prompt treatment of lung infections, treat the TB. Stop smoking and avoid pollution. You must treat the underlying lung problem. Oxygen therapy. Long-term oxygen can reduce the strain on the heart and improve survival in patients with low oxygen levels. With heart failure, manage the heart failure symptoms. Diuretics will help to reduce the congestion, salt restriction, careful fluid management. Here the 4 pillars do not apply, but you can use beta blockers if they are arrhythmias. Then pulmonary hypertension, select specific drugs. In selected patients, you treat pulmonary hypertension under specialist guidance. Some of the drugs we use are endothelin receptor antagonists like bosentans. These dilate the lung vessels. We have prostacyclin analogs like epoprostenol, powerful vasodilators, and you have losiguat, which is very important, especially for chronic thromboembolic pulmonary hypertension, blood clots in the lung. Phosphodiesterase 5 inhibitors, sildenafil, tadalafil. These are also vasodilators that we use, sildenafil and tadalafil. You have to use them cautiously. Avoid if a patient is on nitrates or on very low blood pressure, and you need to monitor the kidney and the liver function. Remember, these drugs for pulmonary hypertension are under specialist guidance and not for everyone. How do we prevent Corpulmonale? Early detection and treatment of lung disease, complete TB treatment and prevent infections, treat COPD well, stop smoking, manage sleep apnea, maintain healthy weight and lifestyle, and treat blood clots well. We have said chronic thromboembolic pulmonary hypertension is one of the causes. Where does sildenafil fit in? Sildenafil is a phosphodiesterase E5 inhibitor. It causes pulmonary vasodilation and reduces pulmonary artery pressure and improves right ventricular function. But evidence recommends its use mainly in pulmonary artery hypertension, primary PAH, WHO group 1. In these patients, sildenafil improves exercise tolerance. It reduces right ventricular afterload and improves symptom and quality of life. Kevin Waitito asks, what is the role of sildenafil in heart failure? And there is important distinction. So for heart failure, sildenafil should be used for right-sided heart failure, Corpulmonale, with pulmonary hypertension, especially class 1 pulmonary artery hypertension. For heart failure with reduced ejection fraction or HFpEF, it is not routine therapy. It should only be used if there is coexisting pulmonary hypertension under specialist guidance, not purely for heart failure. Sildenafil should not be used if there is hypotension, there are vasodilators, BP below 90/60, it should not be used. If there is concomitant use of nitrates, it should also not be used. You should not use it on left-sided heart failure without pulmonary disease and in severe hypoxemia without oxygen therapy. Remember, Corpulmonale is serious but can be managed. Oxygen therapy, treat underlying cause, stay active, drugs for the right-sided heart failure, diuretics, protect the heart by treating the underlying lung condition. Dr. Beatrice Muthui-Mutua, saving lives one heart at a time.